Hello, everyone, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James. I am the physical therapist and owner of Limbs and Things. Our goal is to help aging adults go from I can't to I can. And tonight on Pull Up with Limbs and Things, we're talking to Dr. Jay Siddiqui. He is the owner of Radiant Dental Care. And we're talking about what a dentist wishes older adults knew. So, whether you have dentures, whether you have your permanent teeth, or if you have partials, if you have veneers, this is the person who can answer that question. So, stay tuned and let's talk about it. Welcome, Dr. Siddiqui. How are you?
Good. How are you doing, Chanel?
I'm good. I'm good. I'm glad to have you on. So, tell us a little bit about Radiant Dental Care.
So I started the practice about 3 years ago. I bought it from Dr. Charles Drucker, who was your previous dentist.
Yes.
Um, and he was a great dentist. He did amazing things in his practice. I kind of took it and I brought it to the 21st century in terms of the technology.
Mhm.
I brought in the digital x-rays, 3D bone scanning, digital impressions. I focus a lot on same day crown milling as well as 3D printing in my office. So all these things to kind of make your treatment more efficient, effective.
Got it. Sounds good. Where can we find Radiant Dental Care?
Radiant Dental Care is in Chevy Chase, Maryland, in the Barlow Building, 14th floor.
Yes. Yeah, it's great. Dr. Drucker says good things about you even
Uh,
before you came. And so
Thank
it's been
you.
a pleasure to have you work with me now.
Yeah.
Yeah. So tell us a little bit about what happens to an older adult as they get older in terms of their teeth.
So basically, as you get older, your body is going through some changes. A couple of those changes happen in the mouth. And a lot of this can be contributed to physiological changes. Some of it has to do with your medication. For example, medications can sometimes cause xerostomia or dry mouth.
Mm-hmm.
And that's typical with a lot of blood pressure medications, diuretics, antihistamines, and antidepressants. And as a result, your mouth gets a lower saliva count, and your saliva kind of acts as a buffer for pH.
Mm-hmm.
And without that saliva, it becomes a little more prone to cavities and you know that sort of thing. The other thing that happens is your gums start to recede as a result. It's just a natural physiological change that happens in your body. Your bone starts to recede, your gums start to recede, you get a little more exposure of your roots, you get root sensitivity, and also it's a matter of making sure you keep your bone healthy essentially, in your jaw essentially.
Mm-hmm.
Um, in terms of the dry mouth thing, in terms of helping patients who have dry mouth and preventing cavities, one thing you can do is make sure you stay hydrated throughout the day. There's also over the counter dry mouth rinses and gels that you can use that help to rehydrate your mouth, and that'll help in terms of keeping it moist and keeping the pH buffer there, so that way you're less prone to getting cavities. You can find these at like local drugstores. One example is Biotin, is a very
Okay.
common. Yeah.
Mm-hmm.
Um,
But that's a common thing because I find that a lot of my patients, like I had one today that said, "Oh, my mouth is just so dry,"
uh-huh.
and
Yeah.
then she's taking a diuretic because she has
Mm-hmm.
inflammation in her legs. So it goes
Yeah,
hand in hand.
exactly.
Yeah. So tell us anything else you want to share about older adults that you wish we knew.
Yeah. Another talking point that I have is that you shouldn't wait until you have a problem to go to the dentist, because
Mm,
a lot of the time when that happens,
too
it
late.
it's too late. Exactly. A lot of cavities that form in your mouth won't cause pain until they've penetrated deeper into the tooth. And this is especially true as you get older, partly because what happens in terms of your teeth physiologically is there's something called the pulp, which is where your nerve is,
Hmm.
and that recedes naturally as you get older. And so it's when it recedes, you're less likely to feel any sensitivity in your tooth. Um, and so as a result, by the time you feel that pain, you end up needing a root canal or an extraction,
Mm,
which is not great. And that's why you should really stay regular on your 6 month cleanings, because that kind of will make sure that you don't develop anything.
hmm.
Um, I have a lot of patients where they come in at the point where it's too late essentially, and they tell me before that, oh, I was feeling a little sensitivity, but I didn't want to come in. At that point, it's reversible. We can do something like a simple filling to fix it. The reason why it's important to come every 6 months is not only for the cleaning, for that reason, is for oral cancer screening. Because oral cancer is a very common thing that occurs in the mouth, especially as you get older. Your cells have been more prone to possible mutations over your life into precancerous and cancerous cells. And so getting a check every 6 months ensures that we're not seeing anything develop. And if we do see something develop, we can catch it early enough so that way it won't cause you any problems in the future, lead to the point that, it might be a simple excision at that point versus, let it develop and all of a sudden you need chemotherapy, radiotherapy.
Yeah. Well, those are big factors because I know a lot of people, once they get a certain age or when they no longer have their permanent teeth, they think, oh, I don't need to go and get the 6-month checkup anymore because my teeth aren't in there. I'm washing them and they're in a case, nothing out of my mouth. Right. So what would you say to the person who says that?
So, you don't have your teeth, but you still have your mouth. So, in terms of taking care of your dentures, that's great. If you can, as long as you're taking care of them at home, that's great. But you still need to come in every 6 months for us to check the denture, make sure the bite is still working well, make sure you still have the retention of the denture, make sure you're not developing any fungus under the denture from wearing it overnight, because what can happen is if you wear it overnight, you can develop a fungus underneath, and that will cause some problems with your gums. Right.
I love it. Okay.
But in terms of making sure that your gums are healthy, your denture is healthy, we don't see anything developing. Sometimes if a denture is ill-fitting, you'll see that you start to form what's called a bony splint, or a sore area on your gums, and that can cause a lot of problems as well. So it's very important to still see your dentist every 6 months, even if you don't have teeth. They can still check the denture. They can run it through a ultrasonic cleaner to help you clean it up in case you have anything sticking to it. And it's just making sure the fit, the form, the function looks good.
Gotcha.
Yeah.
What about people who have dentures, they want to eat, and they decide they're going to eat on their gums?
So there's a lot of people that do that, and that's mostly because of the time. Most of the time, it's because they aren't comfortable with their denture. It's
right.
It's might be an ill-fitting denture. It might be that the bite is off, and that's why it's important to make sure you go to your dentist. You express to them, "Hey, I'm not wearing my denture. That I'm having problems with this," so that way they can reevaluate what's going on with the denture, fix the problem. Maybe it's it's falling out when they chew, and so there's ways to get around that. It's important for the to see the dentist in terms of, are you having any resorption of your bone? Because once you have no teeth, the resorption of your bone in your jaws excels rapidly. In the mandible, or in the lower jaw, when you lose all your teeth, the resorption rate goes up 4 times. When you lose all your teeth on the upper, it increases by double. And
wow.
So that's why you also need to get that checked. There's certain ways around it that you can do, is with implants, for example. Getting an implant retained denture, the implants will help to maintain the bone because it's an active force that's in the bone, and so that active force is what's keeping the bone in place, essentially. And it also helps in terms of retaining the denture. There's a denture called a locator denture, or you could use a bar over denture, where it'll click in and it'll stay in. I tell my patients a lot of the time, in terms of dentures, it's not necessarily a replacement for teeth, it's a replacement for no teeth. And so think of it as, you get a denture, it's about 20% of your natural chewing efficiency. When you add implants into that, for example, an implant denture, you get up to 80% of your natural chewing efficiency.
Makes sense.
And then if you get a fixed bridge on the implants, it's 90 to 95% of your natural chewing efficiency.
So is the fixed bridge on your denture, is that removable?
No, so the fixed bridge, it's basically you get about 6 implants. Some people do 4. I say 6 because if you have one fail, you can still do it on 5. Um, but basically, you put a bridge that bridges all the implants together. It stays in there so it doesn't come out. And that's not a treatment for everybody, though.
Hmm.
It's, you have to be able to maintain it. And a lot of times the denture on implants or a regular denture is a better treatment plan because of the maintenance of it. If you don't maintain a fixed bridge in your mouth by cleaning it underneath, you could develop peri-implantitis and the implants could fail.
Mm.
Yeah. So everything has its ups or its
It
draws and
does.
everything. Yeah.
Totally.
Yeah.
So I want to know, when someone has an issue with taste,
Hmm.
and then you talked about how you have some issues with chewing if you have dentures. Is there any way that having like more of a control of your teeth that improves your ability to chew and swallow, but also to taste what you're chewing and swallowing?
I got you. So, in terms of the taste, there's taste buds on your tongue, but
Right.
there are also taste buds on your palate. And so when you
Mm-hmm.
have a denture on the top, you're covering up all those taste buds, and that's part
Uh,
of the reason why that happens.
mm-hmm.
Um, Now, of course, it's you still get the taste from the tongue, but there's not really any way to get around the taste from the not having the taste buds on the palate unless you do what's called a horseshoe denture. But in that case, you end up needing implants for that.
Mm-hmm.
And basically, it's a horseshoe that goes around the ridge. It uses the tissue to stay supported with the implants, but it won't cover the palate. And a lot of patients like that, as opposed to the full denture, not only because of the taste, but also because it's more comfortable. It retains better, and yeah.
Gotcha. That's good points. Okay, so I see a lot of people who have Bell's palsy.
That have what?
Bell's palsy.
Mm-hmm.
And I'm wanting to know, what are the chances of you running into someone that has Bell's palsy, and what do you do when you see it?
So, I mean, I have patients with Bell's palsy that come in all the time. The question is in terms of what do I do when I see them in terms of like hygiene wise, or
Anything you do.
oh, in terms of anything I do. I mean, I
Hmm.
treat them like any other patient. I get them in my room, I clean their teeth, I review the X-rays, I make sure I don't see any decay. A lot of the time, these patients have trouble, hygiene wise, and I talk to the caretaker as well and make sure that if they're not able to brush their teeth, that the caretaker is helping them because a lot of the time they can't do it.
Yeah.
Yeah. But in terms of it's regular maintenance. They come in every 6 months.
Yeah.
We clean their teeth. We check all their teeth, make sure everything's okay. Go over oral hygiene, and just make sure they're good.
Good. Okay. From a PT perspective, our
Hmm.
main goal is opening their mandible, like you discussed, and
Hmm.
trying to make sure that they have the good
I got.
range of opening and closing their mouth, moving their eyes and nose and their lips.
Oh, I got you. In terms of that
All,
aspect.
yeah, all of those
Hmm.
things.
Yeah.
And so I found that a lot of people drool.
Yes.
Their mouth is turned to the side, and
Hmm.
we're trying to figure out ways to help them. If they take a sip from a straw, how they
Right.
can cover their mouth around those things. So,
I
yeah,
got you. I mean, it's probably good in terms of your realm, in terms of helping them develop their muscles and how to form that kind of that seal around the straw and
yeah.
everything.
Mhm.
I think those constant exercises, and I'm sure this is true for physical therapy in general, doing those constant exercises develops those muscles to train them to be able to perform a certain task that you usually see in everyday life.
Right.
Yeah.
Absolutely. What about when you encounter people who say they've had a stroke and they've
Mhm.
had difficulty moving their tongue
Right.
when they come in? Is there anything that you would suggest for someone who's possibly had a stroke or any paralysis in the mouth per se,
Mhm.
and they're trying to figure out the best way to either brush their teeth or maintain appropriate dental hygiene?
So it's a little more difficult in terms of the stroke patients. Again, they probably come to see you in terms of physical therapy to help redevelop their strength in terms of
Mm-hmm.
brushing and everything. And I think that's probably the biggest thing that they need to do is see you and make sure that they keep developing that strength, that muscle to be able to brush and everything.
Mm-hmm.
One thing is definitely, I mean, I don't know if it would necessarily work for a stroke patient because of gripping it. An electric toothbrush. I tell all my patients at this point, get an electric toothbrush. The reason is because you, as you get older, you lose, grip strength. It's, you don't focus as much on your teeth, right? You're just kind of doing the motion, you brush and you get out of there.
Mm-hmm.
Um, an electric toothbrush, it does the work for you. What you do is you put it on your teeth, you let it do its job. You just go around each quadrant, make sure you're doing 30 seconds each quadrant. A lot of the toothbrushes now, they'll have aids to help you in terms of
Like timers.
a timer. It'll buzz every time you're 30 seconds in a quadrant. You move to the next one, move to the next one, move to the next one. The other thing that I've seen on a lot of them is pressure indicators. So the toothbrush has a little LED
Mm-hmm.
that will change colors based on how the pressure is. So like on my toothbrush, I have it where if I don't put enough pressure, it's a white LED. When I put enough pressure, it's a green LED. And then if I'm doing too much pressure, it's a red LED. And so that really helps in terms of making sure you're brushing adequately.
Mm-hmm.
Yeah. So definitely this goes to everybody. I think everybody should have an electric toothbrush.
I agree.
I've seen patients that, I've recommended electric toothbrushes and, they had poor oral hygiene at that appointment. 6 months later, they have much cleaner teeth.
Just from changing from the manual to the electric.
Oh yeah. I've seen huge differences in oral hygiene.
Great.
Yeah.
Okay. Anything that you haven't said that you think you should share?
I think I have a couple notes. Let me just scan
Sure.
through them. I think we covered most of everything. One thing I will say is technology has come to a point that it's made dentistry a lot less painful. It's more efficient and more cost effective, especially for elderly patients. It's difficult to come to the dentist multiple times and sit there with an impression in your mouth and everything. Now we have intraoral scanners that take a digital impression of your mouth within a minute, and you don't have to sit there with any goop. From that intraoral impression, I can take it, I can design crowns and different devices, partial dentures, full dentures, and I can send it to my mill, have a crown done same day. I could even print a 3D printed denture within the same appointment as well, for patients who need to have something same day, they're looking to get something soon. And they're kind of limited in terms of their mobility of getting to the dentist, to and from the dentist. So a lot of them don't have the capability of driving, and they have to have a caregiver drive them to the appointments. So having that ability to do same day dentistry is important. It helps the patients, to minimize the amount of times they have to come in. And also, it also makes it accurate in terms of, for example, implant planning. I am able to overlay my digital impression with a 3D scan of the bone. I can plan it in my software exactly where I want the implant, and then I put the guide that I print, and it literally can be a 45-minute to an hour appointment, and the implant is exactly where I want it to be. The bone looks great. It's minimally invasive. It's great healing. And so, it's dentistry has come a long way in terms of making patients more comfortable and less time in the chair.
Great.
Yeah.
So, what would you say to someone who wants to come in, but they have someone who is probably a little either sensitive to sounds or light, possibly with dizziness, or just someone who has a cognitive change, say they have dementia?
I got you. In terms of the sensitivities, like for light and sound, we have earplugs at the office in case they need them, so that way they don't have to hear all the drilling and everything. In terms of the light, I can turn off the light in the operatory. I can use just a little headlight where it focuses just on where I'm working. In terms of the dementia, it's important that the caregiver comes, with the patient. make sure that, I can explain to them what's going on in their mouth,
Right.
what needs to be done on their part, because a lot of the time dementia patients won't remember, or they'll forget, and they won't be able to take care of their teeth properly, and that's where the caregiver really comes into play. It's such a vital role for them to have a proper living aspect.
Absolutely. There have been a couple of patients that I have who I end up sending to speech therapy because they like to hold food in their mouth.
Mm-hmm.
Is there anything teeth wise, dentistry aspect wise, that is something we should know about keeping food in your mouth for too long?
So what kind of food are we talking about?
So we're saying, say it's oatmeal,
Oatmeal.
or say like it's cereal and they've just got it trapped, or it's liquid and they
Okay.
can't seem to expel it. They won't open
Oh,
their
okay.
mouth or something like that, or they're not
So
swallowing it.
you gotta be careful in terms of keeping things in your mouth. Basically anything with carbohydrates like sugars or
Mm-hmm.
starch and all that. A lot of soft breads actually have sugar, and if you keep them in the mouth, it creates an environment for bacteria to thrive. For a cavity form, you need three things. You need the pH, the low pH. You need the food source, which is the sugar, and then you need the adherent source, which is the tooth.
Mm-hmm.
So if they have the low pH and they have the teeth in their mouth, and they have something sitting there forever in their mouth that's a food source, it's going to develop more cavities likely. And this goes especially for when I talk about sipping on soda or sipping on like a lot of patients. I have, for some reason, a lot of patients like what's the orange drink? The high, not high C, it's Sunny D.
Yeah. Mm-hmm.
I have some patients who like Sunny D, and I tell them, listen, if you're going to drink it in one go. Don't sip it throughout the day, because that constant lowering of one, orange juice is acidic. So
Mm-hmm.
constantly lowering the pH in your mouth, having that sugar source in your mouth all day, that bacteria is able to thrive all day for you. So basically, you drink this, swish some water and get it out of your mouth, basically. I
Got
know,
it.
I know some people love the taste, but you gotta maintain your mouth. Come on.
Absolutely. Okay, let's talk about the hard things we like to eat. Like a lot of people like peanut brittle,
Okay.
or they like ice like me. So we have to make some changes. Tell us why.
So you want to stop chewing on the ice. The reason is because those hard things, when you chew in your mouth, your teeth become more susceptible to cracks, and cracks are dangerous because you don't know. One, it's hard to tell when you form a crack because it's not really symptomatic. Two, it can propagate down the tooth. It allows bacteria to seep in, just cause some decay. And then three is when a crack eventually causes a fracture, you never know how the tooth is going to fracture. The tooth could fracture to the point where you need to pull the tooth out. It could fracture a little bit, but
Mm-hmm.
it's going to fracture some which way eventually. And so that's why you got to kind of, it's not a great habit to have in terms of dentistry.
No.
I understand a lot of people have it, but I try to sway them away from that.
Mm-hmm. Okay, so if you could give us top three things we should do as our teeth get older. Say you're in your 40s or you're in your
Mhm.
late 30s and you're trying to make sure that you maintain your teeth
Mhm.
without having to have them removed. What are some things you should do right now?
Um, I think it's basically forming all good habits. It's start going to the dentist every 6 months. Getting your checkups and everything. Try to minimize. I mean, hey, I love indulging in sweets and everything, but try to minimize it to the point that it's like you have it once or twice a day. I'm not going to say once a day. But forming those good habits will help you in the long run.
Mm-hmm.
And then the electric toothbrush and flossing. You got to floss. The water pick's great, and I love using my water pick, but I use it along with flossing. There's not enough research to say that water flossing alone is as good as flossing. Um, so no matter what, floss. I like to floss at night because it gets stuff out of your teeth.
Mm-hmm.
Brushing twice a day. I floss at night, I brush my teeth, and then when I wake up, I brush my teeth. Doing that and using the electric toothbrush. Doing that constant brushing, it's basically removing the biofilm from your teeth before it can form anything hard, essentially.
Okay.
Yeah. And so making those habits now will save you in the future. And they always say that oral health is connected to systematic health.
Totally.
If you form these good habits now, you're less likely to have plaque on your teeth. They say, the plaque, when you have plaque on your teeth, it can develop into your blood and everything, even.
Mm-hmm.
And you get plaque in your arteries and stuff. So it's important to form those good habits now while you're younger. I mean, younger, but even if you're older, you develop those habits now. I tell you, I tell patients, you start flossing after 2 weeks, you'll see that the inflammation in your gums is going to start to go down. You
Mm-hmm.
won't have as much bleeding. That constant inflammation in your gums it's not good for you because it's inflammation. That's what helps to cause bone loss, because there's all these cytokines and everything that are constantly in that area that's causing the bone to recede.
Right.
Yeah.
So, we talk about receding and people think their hairline is receding. Is that what happens also in your teeth too, that the gums are?
Yeah, your gums start here and they start to recede away. And so, when you're young and you're not flossing, you don't notice it. But as
Right.
you get older, it's important that you're still flossing, not only because of the receding, but also because it helps to prevent cavities. Because the most common area to get cavities is in between the teeth where the food's getting stuck.
Mm.
And that's also the place where you're less likely to see it. On the top of the tooth, you're going to look in the mirror and say, oh, I got a cavity, I got to go in and see the dentist. In between the teeth, you're never going to see it until it's too late.
Got it.
Yeah.
Well, I want to thank you so much for joining us. Tell us, with the information below, you can say it out loud, how we can reach you at Radiant Dental Care.
So you can reach me through my website at www.radiant-dental.com or through my email, jay@radiant-dental.com. If you have any questions, let me know. And you can also call my office, 301-652-2222. I didn't put that in there, but it's on my website.
Lovely. I thank you so much for joining us and sharing all of your knowledge about older adults.
Yeah, thank you for having me.
Yeah, absolutely. So if you have any questions, if you're watching, as always, Pull Up with Limbs and Things is to confirm something you know, challenge something you don't know, and give you the opportunity to share that information with someone else. Be sure to see Dr. Siddiqui at Radiant Dental Care if you have any concerns about your mouth. Do it before that there's a problem.
Yes, I'll see you at your 6-month training.
Exactly. And you can always contact Limbs and Things at LimbsNThings.com, or you can give us a call at 202-643-2636. Have a great evening, everyone. Thank you so much, Dr. Siddiqui.